All the slides used here belongs to their respective owner. I or the channel does not claim any rights over them. Hi, I am Shahan. Welcome back to my channel, and in this video we will learn about cholera. So without further ado, let's get on to it. Okay, now what is cholera? Let me discuss about cholera. What is the definition of cholera? Cholera is a acute intestinal infection. So basically it is an infection which occurs acutely, okay, suddenly. And it is caused by a bacterium. The name of the bacterium is Vibrio cholerae. So what is the name of the bacterium? Vibrio cholerae. It causes the intestinal infection that is known as cholera. Now, this cholera has a very short, it has short incubation period. Okay. Now, what is incubation period? You know that after the bacteria has entered inside our body, the manifestation of the first symptom between these two, we get incubation period. So cholera has a very short incubation period, less than 1 to 5 days, okay, less than 1 to 5 days, and it produces enterotoxin. Very important, it produces enterotoxin. Now you can see this picture. This is actually an electro micrographic picture, and here you can see how the Vibrio cholera looks like in electron microscope. You can see how it looks black and white, and it is just like a comma, and you can see how it looks. Now let us discuss about the microscopy and the structure of this bacteria. You can see this is the structure of Vibrio cholerae, and the Vibrio cholerae is a bacterium which is covered by capsule and cell wall. You can see the red color which is covering, that is known as capsule, and the yellow color which is there, that is the cell wall. So these two are basically the covering, and another is the green one. You have another covering known as plasma membrane. So these three, capsule, cell wall and plasma membrane, these are the three coverings of the bacteria. Now you can see inside, what is there inside the bacteria? You can see the red coiled structure inside the bacteria. That is nothing but the DNA, that is circular DNA. Along with DNA, you can also have the ribosome and plasmids. Now you know what are ribosomes? Ribosomes are the protein producing cell organelle. Yes. And what is plasmid? You know, these are extra amount of DNA. These are plasmid. So all these are there. And what are the things that is striking out from the covering? That is known as pili. P-I-L-I, pili. What is pili? Basically, pili are the things which are used for attachment to surface and also for the sex. That is sex. Pili are for sex. So all these things are there. Now let us come into the symptoms of cholera. This is very important. What are the symptoms of cholera? Number one symptom you will get is vomiting. Very important is vomiting. Along with vomiting, you will have another very important symptom, that is diarrhea. You will have diarrhea. So the patient will have a lot of stool, and frequency of the stool coming out will be increased. The patient will always vomit, and if you check the BP of the patient, it is low. So blood pressure is also low. And what about weight loss? Yes, the weight is also lost. Weight loss, and this weight loss procedure is very rapid procedure. So you will have rapid weight loss. That is very important in cholera. Rapid weight loss, vomiting, diarrhea and low blood pressure. Along with that, the patient will also complain of increasing thirst. The patient will urge to drink a lot of water. So increase thirst. This is very important. Along with that, if you look at the skin elasticity, you will find out that the elasticity of the skin is lost. So loss of skin elasticity, all these are the symptoms. Now let us come into the 8 key items for cholera response. So if we want to treat the cholera, we can use all these items. We can use antibiotics, which is very important because we are treating against a bacteria, Vibrio cholerae, so we have to treat with antibiotics. Next is cholera bed is very important. You can see the bed has a hole inside it. Why this type kind of bed? Because this bed will allow the patient to have a lot of stool outside. So as the patient is having diarrhea and a lot amount of stool, frequency of the stool is increased, so we will have cholera bed. Next is cleaning equipment must be very ready for a cholera patient because the patient will rapidly vomit for a lot amount of time. So cleaning equipment. Next is infusion and catheter. This is very important. You have to infuse the patient and you have to give catheter. You have to give another very important thing that is known as ORS. Oral rehydration salt. Oral rehydration salt, ORS. That is very, very important. Now, why it is given? Basically, the balance of the ions which is there inside our body, we have a certain ion, sodium, potassium, all these are in balanced condition in a particular range. Like for sodium, it is 135 to 145. For potassium, it is 3.5 to 4.5. In this way, it is milliequivalent, and all these things are maintained inside our body in a proper equilibrium, in a proper maintained state. But if this is lost due to diarrhea, due to vomiting, then we have to take the rehydration salt. These contain salts of sodium, potassium and other items. Basically, we use the WHO formula. I will show you picture of the ORS salt, you can understand. Along with that, we have another thing we can use in the cholera patient, that is chlorine. This is also very important. Along with that, we use protective clothings because a cholera patient, we must protect ourselves. Along with that, you have the plastic sheathing. So all these basically the items that are used in a cholera patients. Among all these, antibiotic is very, very important. Now you can see this picture. You can see this picture is actually the ORS I was talking about, that is oral rehydration salt. Oral rehydration salt, ORS. Now this is basically a WHO recommended formula. You can see WHO recommended formula. So WHO has recommended this, and you can get a certain amount of composition in it. Like sodium chloride is this 0.52 gram, and we have potassium chloride 0.30 gram, sodium citrate 0.58 gram, dextrose 2.7 gram. All these like sodium chloride, potassium chloride, dextrose. So all these components will together will produce this ORS, oral rehydration salt. And along with that, you can find out the sodium, potassium, chloride, citrate, dextrose, all these are the concentration which are given in millimole per liter. Now, what is the prevention of cholera? Basically, cholera can be prevented, number one, by washing your hands. This is very, very important. Prevention of cholera by washing your hand. This is number one. Wash your hand repeatedly with soap and water because the bacteria will be washed away. The Vibrio cholera will be washed away. Next is drink and use safe drinking water. This is very important because mostly the cholera occurs due to contaminated food and drinks and all these things, mostly the drinks. So we have to understand that whenever you will be drinking, you have to drink and use safe drinking water. Use safe drinking water. Number 3, clean the floor. Clean and sweep the floor. Make every cloths, every items which the patient is using, and clean it. And you have to consider getting vaccinated, which is very important. Along with that, you can cook the food items. Now, why cooking? Basically, when you cook the food item, when you boil the food, then the bacteria, if it is there inside your food, it will die. So you have to boil it and then you eat it. Now, this is the last picture and last slide of this video. You can see these are contaminated water, and the child is taking that contaminated water for drinking. And if they drink these water which is mixed with garbage and all these things, they can get cholera, and they will have a lot of vomiting and diarrhea and other things which I discussed in this video. So this is the end of this video. If you like this video, make a thumbs up, and please write down in the comment section below if you like this video, because this inspires me a lot to make many more videos like this. Thank you so much. Have a nice day. Bye bye.